Welcome to another edition of our Six Questions podcast. I'm Trent England at Save Our States, where we defend the Electoral College 365 days a year and, one extra in leap years, which is, I think, coming up in 2024. So we'll be working extra hard that year. But no, I'm glad to be here, obviously not in the usual studio, out in Washington, D.C. at a meeting with a lot of state legislators, including a lot of brand new legislators from around the country, educating them about the importance of the Electoral College and constitutional federalism. As James Madison said, state legislatures are supposed to be a double security for the rights of the people. It's important to help legislators understand their role in protecting our rights, especially vis-a-vis the federal government. Someone who is out there protecting the rights of medical patients, which is, every one of us at some point in our lives, is Dr. Keith Smith. He is the co-founder and medical director of the Surgery Center of Oklahoma, and I'm excited to have him on the program. Keith, welcome.
Thanks for having me.
Yeah, it's great to have you here. Talk a little bit about free market medicine. Let's start off with the Surgery Center, which has become kind of a phenomenon and I think copied, at least in some places around the country. But what sets the Surgery Center of Oklahoma apart from other medical facilities where you can get surgery?
I think we set ourselves apart from the very beginning with our pillars and our mission when we decided that we would never accept any money from the federal government and the strings attached to that. We also decided that patients would know before they arrived at our facility how much they were going to pay us. At the time, we were filing insurance claims out of network. But later on, we realized that, that wasn't free market enough. As much as we thought and championed ourselves as free marketeers, we had not gone far enough. So in 2009, I launched a website with our all-inclusive pricing on that website, and we deal with no insurance carriers whatsoever. So that, I would argue, started and was the beginning of a marketplace in the United States. If there was one at all where there was price competition, it was fledgling or absent. And I would say now it is vibrant. So what sets us apart is we really are missional in our approach to taking care of patients, but we're also missional in the principles we think and the financial principles that ought to guide those of us on my end and on the institutional end taking care of patients.
So I think when sort of popped in my mind, you're like the Hillsdale College of medical centers. So you said you don't take federal funds. I think a lot of our viewers would be familiar with Hillsdale. So that comparison popped in my mind. But you talk about insurance, and I would guess that some people hear that and think, well, this must only be for rich people, because how could anybody afford surgery without medical insurance? We've been accustomed to believe that. So how does that work? How can anybody afford surgery if they don't have an insurance company who's stepping into the process and negotiating and paying all the bills?
Yeah, well, I would argue people cannot afford surgery who have insurance. From the very beginning, we found that the prices that we quoted over the phone were less than people's deductibles. And that was an all-in price. That was surgeon anesthesia facility. That number invariably was less than a patient's deductible. We were quoting $1,900 for a breast biopsy, and the medical center down the street, it's so-called not-for-profit status, was charging $19,000 for just the facility.
So you are for-profit. The hospital down the street is nonprofit, and the hospital down the street is charging, multiple times more than you charge. I'm sorry. I guess I'm sort of asking the question that I hear in listeners' minds, which is, how is that possible, right? How could that, do you what are you not paying for? What is it that allows you, is this some kind of Walmart where you're running people through an ultra cheap process and the hospitals are doing things a lot better? I mean, I know that's not true, but I just wonder what people think, because we're accustomed to think that it's $100,000 for this and $50,000 for that. So how does this work?
Yeah, we've joked all along that it must be really hard work to not make a profit, since they have to charge so much more than we do. And we've been open 25 years now, Trent, and I'm happy to say that I am asked that question rarely. I am asked that question rarely now. In the beginning, I was, is this some drive-by slipshod? Are you kidding me?
Mhm.
Now the focus and the bright light is on the price gougers. I'm not asked anymore, how can you do it for so little? Typically, I'm not the one that gets the question. It's the big price gouging hospital that says, why are you charging multiples of what Surgery Center of Oklahoma is across town? And I think that's happened because our quality reputation has become well known. And so, the whole idea that we are cutting corners or something like that it's not even in people's minds now. Now the focus and the bright light is exactly where it ought to be. And that is on the bankrupting machine that so many patients enter unknowingly these days. And the answer to your question really is what you see with my price online is what it actually takes what it takes to take care of patients. We don't
Yeah,
have
because
we don't have it in
people,
this. You're looking at it.
and people are actually, I mean, I think, we talk about price transparency in terms of telling people what it actually costs, which seems like such a simple idea, but it's so rare in the medical industry. But I guess the other side of price transparency is that you're not just telling people what it costs in terms of what they're going to pay. You're really telling people what it costs, and everybody who comes to the surgery center is basically paying that, as opposed to the hospitals where it's all this weird shell game of medical billing. I want to come back to that, but let me jump over to question 3 is kind of back in the realm of public policy. And I know, you run the surgery center, you're involved in these debates over public policy. One thing that happened in Oklahoma has happened in many states and happened in just about every state over the last 10 years is that they've expanded Medicare. Oklahoma did this in 2020. Has that brought prices down? I mean, that was supposed to, make medical care more affordable. What have you seen, Keith, in Oklahoma as Medicare has expanded? Excuse me, as Medicaid has expanded. I said Medicare, but Medicaid.
Well, we don't accept any money from the government, Medicare or Medicaid. I think that the people who really pushed for this expansion were the big hospitals who claim that the pricing Medicaid inflicts on them bankrupts them. So we all knew the hospitals were making a lot of money at Medicaid pricing. We've seen, for instance, when we will perform a cochlear implantation on a baby, we have our charge online, and it's there for everyone to see. And surgeons will come to me and say, the hospital is paid more. Just the facility is paid more than our entire online fee plus the cost of the implant by Medicaid. So the hospitals pushed for Medicaid expansion because they like Medicaid and they like that reimbursement, and for all their poor mouthing that, we have to overcharge everyone else because we're so poorly funded by Medicare and Medicaid. They didn't promote Medicaid expansion because it was going to be bad for their bottom line. It was going to help them. It actually was going to be hard for them to hide how much more of a profit that they were making. So I think Medicaid expansion will fuel the poor mouthing claims of the price gougers. It provides a justification for overcharging and cost shifting others that is false. but I think the hospitals will take advantage of that, and we'll see prices continue to go up. However, there is this thing called market competition, and there is no place on the planet that it is more alive and well than right here in Oklahoma City. And the hospitals are very aware of what is going on, not just at Surgery Center of Oklahoma, but at other facilities in Oklahoma City that have kind of put their toe in the water and are copying our model. So while government continues to throw gas on the price fire, the market continues to deliver value. As I like to quote Hans Hoppe, he says, "Markets deliver goods and governments deliver bads." And I think there's no industry in which that is more true than the medical industry, and Medicaid expansion is a great example of that.
I'm talking with Dr. Keith Smith. He is the co-founder and medical director of the Surgery Center of Oklahoma. So, Keith, one thing that we see in healthcare, we also see it in education in various ways, is government comes in, gets involved, and then claims that we need a lot of regulation in this area. Because from my interpretation is partly government constructs these monopolies or situations that are similar to monopolies, and then says, well, there's not a lot of competition, so we need a lot of regulation, and that then has the effect of diminishing competition even more. What is the effect of all this government regulation, and what are there things that are affecting you, even in your free market medical world, that either the state or the federal government could get out of the way further and allow you to better serve patients?
Yeah, I love Per Byland, the professor at Oklahoma State University, wrote a book where he just said, let's call it what it is. Regulation is a choice restriction. Let's just call it choice restriction going forward. And that's what it is. Regulations, ostensibly created and written to protect the consumer, are always written by the people who have a seat at the table. Regulations are always created by the industry insiders to their benefit. Sometimes it looks like it is choking back the greed, of the seller in the marketplace. Typically, what a regulation in its purpose is to crush the little guy. Regulations are typically created by the big players at the table, and they know what their smaller competitors cannot endure. And so that is what regulations typically look like. So right now there are small hospitals in rural areas. There are small surgery centers and imaging centers that struggle under the burden of regulations that are belched out by the state health department and by legislation in all areas, federal, state, and local. Property taxes choke them, while these not-for-profit behemoths pay none. So there's really an unlevel playing field. The federal government subsidizes the hiring of physicians by hospitals by overpaying doctors who are hospital employees compared to those who are independent. So there are a lot of challenges out there that are downstream of regulations. I would argue were created to benefit the big players. And in spite of that, this free market movement, this market competition continues to grow and continues to encroach on this fortress that these giant hospital systems thought they had erected around their little empires. These giant insurance companies, they charge huge amounts for coverage, whatever that is, for people, with a $7,000, $8,000, $10,000 deductible, and they've turned all these people into sticker shocked customers who are shoppers, and finding websites with pricing, and they're telling these hospitals you need to match up, and looking at themselves in the mirror and scratching their head and say, why don't I join a cost sharing ministry? Why am I paying $1,500 a month to Blue, United, Cigna, Aetna for nothing, essentially? So all of these regulations that have been created are there to not protect the customer. And I would encourage people to really wrap their minds around that. These regulations are there to protect the industry insiders, but the market is a beautiful and a powerful thing. And it's really bringing down this house of cards. In spite of all of that, I remain long-term very optimistic.
Yeah, just as you were saying that, I hadn't thought about this before, but I wonder if part of the sort of pro-government side's attack on contractors, in terms of Uber drivers and the whole gig economy and all this, is partly driven by the fact that, when you're an employee, oftentimes you don't see how much those health insurance costs really are. Whether your employer pays it all or you even pay a share, it just, it sort of comes out, it's pre-tax, and it disappears like your income taxes do. And when you're a contractor and you're writing a check, something like a healthcare sharing ministry, which in my pricing things out tends to cost maybe 10% of what insurance costs, becomes a lot more interesting and appealing. But I think a lot of people just don't see that. Keith, I have to ask you, because of course, Save Our States, we're all about federalism. What's the federalism angle with all of this? I mean, you're located in Oklahoma. Oklahoma, relative to states like California and New York, tends to have lighter regulation. Certainly has lower taxes in most categories than those states. What is the federalism angle for free market medicine? How is that helping you, and how does that connect with the future of this movement, and maybe the movement of people and businesses among the states? We've seen that play out with regard to tax policy and housing affordability, but I think educational freedom and healthcare freedom are probably additional factors that are going to affect where people want to live.
Yeah, and I think just the atmosphere, the people in Oklahoma, and what they do, how they work, how they make their living. It's a very wholesome environment compared to many more surrounding states. I would argue it's a great place for anybody to raise a family. I would argue as good a place as any in the country. I think we saw the federalism angle really play out during COVID. A lot of states were relatively more locked down than Oklahoma. We had a very short, very brief shutdown of elective surgeries here. And I faulted our governor for that. But the thing I like about him is he admitted that he was wrong. He admitted he made a mistake. He figured out who lied to him, and he fired a whole bunch of people for that. But during that lockdown period, or I'm sorry, as soon as we opened back up, there were patients from many states outside of Oklahoma that were much more locked down. And they would reach out and they would say, can you help me? My wife has a breast mass, and we've been told that's an elective surgery. And so, that we consider that not emergent, but certainly not elective. So we just created a third category. We called it urgent. So people traveled to Oklahoma from all over the United States, and they knew what they were going to pay before they got here, which helped. That patient that had gallstones. Well, people that have gallstones in their gallbladder, sometimes those stones get loose and they occlude the pancreas, and then they get really sick and they go to the intensive care unit and they don't do well. So we considered gallstones basically an urgent procedure. So we continued to do those surgeries even during the state lockdown here in Oklahoma. So the federalism angle, I love it because the states don't act like colonies. They
Mhm.
act like states with pushback power, where intercession and is basically an option. So the states can push back. You can have all these federal mandates, and anytime a state pushes back against a federal mandate, I like that. We saw that during COVID. It brought many people to Oklahoma's shores that would not have otherwise come, and then they went back and told all of their friends, and so we're busier than ever because they've had their experience at Surgery Center of Oklahoma, and they tell all their friends, and when they need surgery, they come. So the idea that states are competitive with each other for which ideas work, I think really played out during COVID, and Oklahoma was more of an open state. And I think a lot of people got the flavor for that, and they know more about what Oklahoma is all about.
Yeah, and our governor was certainly reelected with huge margins, and I think partly because of that, and as you said, not just always getting it right, but being willing to admit when he didn't get it right, which is fairly unique in
I like
people
that.
in elected office.
I like that.
That's right. Well, Keith, our last question on Six Questions is always the same. It is, who is your favorite founding father and why?
I read an article this morning on my favorite website, on LouRockwell.com, and it's an anti-state, basically, website. And the author's name is George F. Smith, no relation, but he makes the case that Thomas Paine really was the most important founding father, even though we don't think of him as a founding father. The article was compelling. And after reading that, I think I'm going to agree with George F. Smith's article this morning listing Thomas Paine, because ultimately Paine demonstrated what we all know is true, and that's that ideas matter. And his pamphlets kept the morale of the troops up during the secession movement away from England. And he was a very, very powerful, very gifted writer. He died penniless and he died friendless.
Yeah.
So he was not in the business of making friends. He was in the business of ideas. So you asked me today, I'm going to give Thomas Paine the nod.
I like that for a couple of reasons. Yeah, I mean, Thomas Paine, as someone who writes a lot, the influence of Thomas Paine, which was all through the written word, taking those ideas and converting them into writing that was appealing to the great mass of the Continental Army and the militia and just patriots during the Revolution. Obviously, I like that. He was originally a corset maker, I think, in Britain, and so he went from lifting the bosoms of women to lifting the spirits of Americans, which I think is fairly impressive as well. Just last Sunday, Thomas Paine got a quote and a shout out at the homily at my church, which is actually right up by the surgery center. So yeah, which I thought was a little, very well done by the deacon who delivered the homily. You don't hear a lot of Tom Paine quoted in Orthodox churches, but
No, no,
so yeah, it's a timely reference, and we will when we push out the podcast, we'll see if we can connect that link to the article LouRockwell.com. That sounds like good reading for all of us. Dr. Keith Smith, co-founder, medical director at the Surgery Center of Oklahoma. How can folks stay in touch with your work, the Surgery Center, and the Free Market Medical Association?
Our website is surgerycenterok.com. There's a lot of information there. There are a lot of videos there that people can watch. The best way to keep your finger on the pulse of this movement is the Free Market Medical Association, fmma.org. Our annual meeting is in Kansas City, May 3rd through 5th. We've had Ron Paul and Steve Forbes and Kennedy of Fox Business as speakers in the past. We're proud this year to have Peter Klein, the world's expert on entrepreneurship, who's a professor at Baylor. He'll be our keynote this year. So it's a movement that is really spreading. That Free Market Medical Association is in 37 states now, and I would argue this movement is really what shook Washington D.C. by the collar, and right or wrong, manifest as a mandate, an executive order for hospitals to post prices. My friend Larry Van Horn, the economist from Vanderbilt, has basically said, this all started at Surgery Center of Oklahoma, and he basically wrote that executive order. So this movement is growing, it's powerful, it's reason for hope. And there's not a lot of good news in healthcare these days, but if people will watch our website, the Free Market Medical Association, it'll lift their spirits, as Thomas Paine has done.
That's right. And I'll put in one other plug. I mean, if folks are, wherever you are in the country or the world for that matter, if folks are going in for surgery, I mean, to go to your website and just see what it would cost and be able to take that into their own medical facility and say, hey, look, they can do the same procedure all in for this price is, a great, I almost said weapon. I don't know if I want to be that strong, but it's a great tool for people to hold, their own medical facilities accountable, whether you're in New York or Seattle or wherever. So really, really good resource. Dr. Keith Smith, thank you so much for being a part of Six Questions.
Thanks for having me.
Thanks to all of you for watching, for listening. Remember to give us a good rating on, wherever you're finding this podcast. Share it with your friends. Thanks for being a part of the Save Our States community on Facebook, on our email list. We are gearing up for legislative sessions, which begin in January, but bill filing is going on already. We're seeing bills filed to try to subvert the Electoral College, primarily through the National Popular Vote Interstate Compact. We're tracking those things. We're letting people know through our online communities so that you then can go and share with your own legislators wherever you are your views on all of this. They're hearing from the National Popular Vote lobbyists. They're hearing from the other side for sure. The question is, are they hearing from us? And so we want to give you the tools to do that. Please connect with us at saveourstates.com or on Facebook or Twitter, and we will continue to carry on the fight. Until next time, I'm Trent England for Save Our States.